Hypertension is one of the most prevalent and modifiable risk factor for the prevention of cardiovascular disease. The diagnosis of hypertension is basically depends upon the measurement of blood pressure in the doctor's office or within the hospital premises by some healthcare providers, not only doctors but also by nurses or physician assistants. Some essential points have to be noted when you measure the blood pressure in your office. One is making the patient comfortable and waiting for about 5 minutes before you start measuring the blood pressure. Second thing is that the patient should be comfortable sitting on the chair with a back support and with the arms resting on a table, and no interaction of the healthcare provider with the patient while attempting to measure the blood pressure. Ideally, the blood pressure should be measured 3 times with an interval of 2 minutes between each recordings, discarding the first measurement and taking the average of the last 2 measurements. That will give you the blood pressure of that patient at that point of time. But to make a diagnosis of hypertension or high blood pressure, you need to measure it more than once in your office, where the interval between the 2 measurements or 2 the visits to the office should be at least 4 to 5 days. And if it is consistently elevated above a certain value, then we are going to label them as having high blood pressure. The current guidelines according to the European Society of Hypertension is when these values, office measured blood pressure values, are in excess of 140 by 90 millimeters of mercury, then we are going to label them as high blood pressure, which requires further investigation as to the cause of hypertension and to the consequences of hypertension on the heart and blood vessels. Once you confirm it, then a series of steps have to be taken which will lead to effective control of the blood pressure. These include changes in the lifestyle measures, that is, consuming less amount of salt, more amount of potassium containing food like fresh fruits and vegetables, and increasing your physical activity, maintaining ideal weight, and stopping smoking if you are one, and limiting the alcoholic drinks to the barest minimum, not more than 2 drinks per day for a male and not more than 1 drink per day in a female. At the end of this lifestyle measures for about a few months, not getting control, then you need to add drugs to control the blood pressure. Important to realize that once we start the drug for control of blood pressure, it is for the rest of the life that they have to continue the drugs. No matter what type of drug you use, it is mandatory that you use those drugs to effectively control the blood pressure. That is the bottom line. Ideally, we combine ACE or ARB inhibitors combined with the long-acting calcium channel blockers, which are effective in controlling the blood pressure in approximately about 70 to 80% of the patients. For those who do not respond to this 2-drug combination, additional drugs should be added to reach the target level of blood pressure, which is less than 140 by 90 according to the European Society of Hypertension, and less than 130 by 80 as per the ACC/AHA guidelines. Whatever you decide to choose, but it should be less than 140 by 90 under any circumstance.